Can you describe your experience with med clerkships?
Okay, so basically, I kind of took a leap of faith, and I'm like, you know what? Let's just do it and see what's gonna happen, you know?
Mm-hmm.
That's the only thing I know about them, like in regards in regards of how I felt about them in the beginning. But I really like the way they structured their website, how they asked all these questions. They looked very professional compared to other websites that I tried.
Okay.
Um, and I liked how they sent me contact details of doctors before we started, and these doctors were talking to me about how um, I should work around getting electives in the States before I come here.
Okay. Great. Great.
They sent me different their physicians. I'm not sure. I can't remember the names, but it was Dr. Mike, Dr. Sam. They were these physicians that they would talk to you about getting into the residency programs in general. It wasn't. No, that's the contact details that they gave me.
Okay.
Yeah.
Would you recommend your preceptor and rotation to your colleagues?
Yeah, I already did actually. Actually, two of my colleagues are currently doing an orthopedic rotation with med clerkships in Chicago.
Okay.
Um, so yeah, so I did recommend it to a lot of people from my university because my rotation was good. At the same time, I did recommend them, and they ended up going there.
Mm-hmm.
They're there currently right now.
Okay. So you mentioned your rotation was good, and I'm glad to hear that. Can you specifically explain anything in particular that you liked about it, and or about the preceptor that you had during your rotation?
Okay, so okay, let's start with the rotation itself. I like the rotation because it was kind of flexible. It wasn't very intense. That's
Mm-hmm.
number one. It gave me time to study and everything.
Mm-hmm.
And at the same time it was something new that I haven't tried before, which is cosmetic gynecology. I don't We don't really touch on this during the actual rotation, so it's a lot of new things to get and a lot of new concepts and ideas. My preceptor was amazing. I really liked working with him.
Mm-hmm.
He's very understanding, very good with the patients, very good. He would let me take histories. He would discuss things with me over and over again.
Okay.
So and he I would say he made the rotation very effective. Ending with is worth it.
Yeah, that makes sense. Can you
Yeah.
describe in detail a specific experience with med clerkships that you were happy with from the time that you applied and through the process? I know you mentioned you were in
Uh,
touch with some physician consultants, Dr. Mike, Dr. Sam.
yeah. Yeah. Okay, so I liked okay, basically because I didn't give enough time for myself to apply for something over the summer. So
Mm-hmm.
I was really happy that they were very responsive because I literally applied for that place 2 weeks before the rotation started. So it was a very short time. I didn't expect any offers or anything. So
Mm-hmm.
I was happy that they worked with me to get something squished
Mm-hmm.
in that summer before my last year,
Mm-hmm.
and that opened doors to many other things. So that's something I'm happy about. I'm happy about how they would give time for me to talk to Dr. Mike and Dr. Sam. They gave me time to what's it called? They gave me some tips
Mm-hmm.
here and there for me to understand how to work around getting into the States. What else? And I'm happy that they did something like that, like this exit interview. Like I didn't really expect something like that. It
Okay.
was just I thought it would just be like pay and go to the rotation and that's it, you know.
Yeah.
They did provide accommodation, but they do provide accommodation. But since I applied 2 weeks before the thing,
Mm-hmm.
I couldn't get a place to stay, so I had to look for a place for myself.
Okay.
Uh, yeah, that's basically it.
Okay.
Be probably looking at doing some research in the States.
Mm-hmm.
If I get my step scores, or if that doesn't work out, I'll probably go back to websites like med clerkships to find some rotations to do here, some experience.
So my advice at this point would be obviously overcome that. Step one, be that done with that, right? And then after
Mm.
that, both research and rotations are a good idea. That though you're going to be studying for both of your step twos, right? So you have to keep that in
Mm.
mind. As far as for CS, for step two CS, that's the clinical skills one that you're seeing the standardized patients. I
Yeah.
would actually recommend that month before you're taking the test, go and do like an internal medicine rotation through med
Okay.
clerkships, and that way you'll have that experience of day to day seeing those patients. And on CS they're gonna have pediatrics, OB, whatever, different scenarios, but the bulk of it is gonna be just general medicine, and so you'll have
Right.
that experience. And so that would be one of my recommendations. That in itself will be a great practice tool for your CS exam, and for CK as well. Clinical rotations, that's when we take these tests during your fourth year, third year. So doing these rotations are going to be very beneficial. Obtaining the letter of recommendations from US based physicians. And med clerkships also, on the other hand, what you were saying, does offer research opportunities. So I would encourage you to talk to your coordinator, and maybe get in touch with your physician consultants again to get an idea of what kind of options you would have. Of course,
Right.
like I said, step one first, and then kind of go about that path. But some of those
Yeah.
rotations in the summer, they do fill up because people are going into these rotations before their application season, so they can network and get these letters in time. So it is something to just think ahead about as well.
Okay.